Hello, this is Dr. Emma Hitt-Nichols, and this is the information on the latest US FDA approvals for the week of March 18th through the 22nd, 2024. Quite a few approvals this week. All right, so we got the FDA has approved bempedoic acid, also called Nexletol, as well as bempedoic acid plus ezetimibe, that's called Nexlizet, and these are both tablets for the reduction of cardiovascular risk and for the treatment of primary hyperlipidemia, either alone or in combination with statins. Bempedoic acid inhibits ATP citrate lyase, that's an enzyme involved in cholesterol synthesis, thereby reducing LDL-C levels. By contrast, ezetimibe works by preventing the absorption of cholesterol from the small intestine, which further lowers LDL-C levels. Combining these mechanisms may help lower LDL-C levels in patients who require additional treatment beyond statins or who cannot tolerate statin therapy. These agents are the first LDL-C lowering non-statin medications indicated for primary prevention in patients at high risk of cardiovascular events, but who have not yet experienced one. The approval was based on findings from the Clearer Outcomes trial, which assessed the effect of bempedoic acid on cardiovascular outcomes in approximately 14,000 individuals with or at high risk of cardiovascular disease. The approval of bempedoic acid and bempedoic acid plus ezetimibe was granted to Esperion Therapeutics. Also last week, the FDA granted accelerated approval to Ponatinib, that's also called Iclusig, in combination with chemotherapy for the treatment of Philadelphia chromosome-positive acute lymphoblastic leukemia, that's PhALLCON, in previously untreated adults. Ponatinib is a tyrosine kinase inhibitor, TKI, that works by inhibiting the activity of BCR-ABL1 and was first approved for use in 2012. The latest approval makes Ponatinib the first targeted agent approved in combination with chemotherapy for previously treated Ph-positive ALL. The accelerated approval was based on findings from the PhALLCON, PhALLCON PhALLCON trial, and that's an open-label phase 3 study involving 245 adults with newly diagnosed Ph-positive ALL. The trial met its primary endpoint, demonstrating a significantly greater MRD negative complete remission rate in patients assigned to Ponatinib versus imatinib, and the rate was 30% versus 12%. As part of the accelerated approval process, confirmatory data may be required to verify the clinical benefit of Ponatinib in this setting. In addition, with this latest indication, Ponatinib was approved in Ph-positive ALL as monotherapy for T315I positive cases and for patients where no other TKIs are indicated, as well as chronic myeloid leukemia, CML. The latest approval of Ponatinib was granted to the manufacturer Takeda. Also last week, the FDA has approved Mirvetuximab soravtansine-gynx, and I'm going to say that as the brand name Elahere, Elahere. That's for folate receptor alpha FRA positive platinum-resistant epithelial ovarian, fallopian tube, or primary peritoneal cancer in adult patients treated with up to 3 prior therapies. This approval of Elahere marks the agent as the first and only antibody-drug conjugate, ADC, in the US for this malignancy, which initially received accelerated approval in November 2022. Elahere acts through targeted approach by binding to the folate receptor alpha on cancer cells, delivering a potent cytotoxic agent to induce cancer cell death. Ovarian cancer is often diagnosed at a late stage and treated with platinum-based chemotherapy. However, many develop resistance to this chemotherapy. The full approval was based on results from the phase 3 Mirasol trial, and the approval of this agent was granted to AbbVie. And now a word from the supporter of this podcast, Nascent Medical. Is your staff medical writing team tapped out? Nascent Medical is here for you. Our team of excellent MD and PhD level medical writers specializes in providing fast turnaround needs assessments, carefully annotated manuscripts, engaging slide decks, and accurate ad-board summaries, and much, much more in any medical specialty, and we're always available. Do visit us at nascentmc.com. That's nascentmc.com and get a speedy estimate. Also last week, the FDA approved givinostat, that's also called Duezat, for the treatment of patients 6 years or older with Duchenne muscular dystrophy, DMD, a rare X-linked progressive and life-limiting neuromuscular condition. Givinostat is a novel histone deacetylase HDAC inhibitor that mitigates muscle damage and slows DMD progression. Symptoms of DMD typically first appear between ages 2 and 5 years, with the disease eventually impairing mobility and affecting heart and respiratory muscles, leading to premature death. The approval was based on results of the EPIDIS trial, a phase 3 study. The approval of givinostat was granted to Italfarmaco S.p.A, which has also established ITF Therapeutics in the US to focus on rare diseases and lead the commercial launch of givinostat. Also last week, the FDA has approved Spesolimab-sbzo, Spevigo, for the treatment of generalized pustular psoriasis, GPP, in adults and pediatric patients aged 12 years and older, and who weigh at least 40 kilograms. This approval expands the indication for Spevigo, which was initially approved in September 2022 for treating flares of GPP. With this latest approval, Spevigo becomes the first targeted therapy available for both the acute and chronic treatment of GPP. Spevigo is an interleukin IL-36 receptor antagonist, and that's involved in the pathway that causes GPP. GPP is a rare and potentially life-threatening disease characterized by widespread pustules on a background of erythematous skin. The FDA's decision for the expanded indication was based on the EFISAIL-2 trial, a 48-week clinical study involving 123 patients. The trial demonstrated that individuals receiving Spevigo experienced a significant 84% reduction in GPP flares compared to those who received a placebo. Notably, among 30 participants who received a high dose of the treatment, no flares were observed after week 4. The approval of Spevigo was granted to Boehringer Ingelheim. The FDA has approved aprocitentan Trivio for the treatment of hypertension in combination with other antihypertensive drugs to lower blood pressure in adult patients who are not adequately controlled on other drugs. This approval introduces aprocitentan as the first and only endothelin receptor antagonist for this indication, marking it as the first oral antihypertensive therapy that works via a new therapeutic pathway to be approved in nearly 40 years. Aprocitentan's mechanism of action involves inhibiting the binding of endothelin, ET1, to ETA and ETB receptors. The approval was based on findings from the phase 3 PRECISION trial, which showed that aprocitentan was well tolerated and superior to placebo in lowering blood pressure at week 4, with a sustained effect at week 40. In this study, aprocitentan demonstrated its efficacy in patients with confirmed resistant hypertension, those who remained hypertensive despite being on a minimum of 3 antihypertensive drugs at optimal doses. The approval of aprocitentan was granted to Idorsia Pharmaceuticals US, Inc. And finally, this week, the FDA has approved macitentan and tadalafil, that's combined known as Opsymvi, for the chronic treatment of adults with pulmonary arterial hypertension, PAH, World Health Organization, WHO, Group 1, and also WHO Functional Class 2 and 3. This marks the introduction of Opsymvi as the first and only once-daily single-tablet combination therapy for patients with PAH. suitable for those who are treatment naive or already on an endothelin receptor antagonist, ERA, or a phosphodiesterase 5 PDE5 inhibitor, or both. Opsimvi combines macitentan, an endothelin receptor antagonist, with tadalafil, a PDE5 inhibitor, targeting two critical pathways in the pathophysiology of PAH. PAH is a chronic and progressive disease characterized by the elevation of blood pressure in the pulmonary arteries, leading to right heart failure and reduced exercise capacity. The approval of Opsimvi was based on findings from the pivotal phase 3A DUE study, which demonstrated that this agent provided a greater reduction in pulmonary vascular resistance, PVR, after 16 weeks compared to either tadalafil or macitentan monotherapy. The FDA granted the approval to Johnson & Johnson. And finally, this week, the FDA has approved atidarsegene or totemcel, known as Lenmeldi, for children with pre-symptomatic late infantile, pre-symptomatic early juvenile, or early symptomatic early juvenile metachromatic leukodystrophy, MLD. This is the first FDA-approved gene therapy for MLD, a rare genetic disease that affects the brain and nervous system due to a deficiency of the enzyme arysulfatase A, leading to the accumulation of sulfatides in cells. This buildup causes damage to the central and peripheral nervous system, resulting in loss of motor and cognitive function and early death. Lenmeldi is a one-time individualized gene therapy that uses the patient's own blood stem cells, which are genetically modified to include a functional copy of the arysulfatase A gene. These modified stem cells are then transplanted back into the patient where they produce the arysulfatase A enzyme, helping to break down sulfatides and potentially stopping the progression of MLD. Treatment with Lenmeldi requires the patient to first undergo high-dose chemotherapy to prepare the bone marrow for the modified cells. The approval of Lenmeldi was based on data from 37 children treated in 2 single-arm open-label clinical trials and an expanded access program. Treatment with Lenmeldi significantly reduced the risk of severe motor impairment or death compared to untreated children, with notable improvements in survival, mobility, and cognitive functions. The FDA granted the approval of Lenmeldi to Orchard Therapeutics. Well, that's it for this week. Again, if you need any medical writing assistance for your company, just go to nascentmc.com. That's nascentmc.com. And if you'd like to get some free downloads on medical editing and the AMA Manual of Style, stuff like that, just go to learnamastyle.com. That's learnamastyle.com. Thanks so much. And do tell your colleagues about this podcast. That would be really great. And I hope you have a wonderful week. Take care. Thanks.